So the news last night that the 350 rand a month was to be reinstated for the unemployed, also including child caregivers, unemployed child caregivers, has been widely welcomed. The pandemic has highlighted the massive inequality within South Africa, and hunger has dropped to levels lower than before COVID-19 changed our lives. Let's discuss this now with Professor Leila Patel, Director of the Centre for Social Development in Africa. And Prof, thank you so much for joining us. You contributed to a really interesting article in The Conversation today, and you spoke about the positive impact that the introduction of the child support grant made in terms of alleviating hunger levels from 1998. So I suppose we've got quite a lot of data that even before the social relief of distress grant came in, that these grants really do change lives. Tell us how that helped hunger in the past.
Good evening, Sally. So we know over a long period, various research studies provided compelling evidence of the impact of grants in general on reducing poverty and inequality, but also food insecurity and hunger. And one of the big drivers of that reduction was the child support grant, which was introduced in 1998. And since then, we've seen a progressive decline in hunger and in child hunger in particular over the past almost 20 years. And this then increased a bit after 2008 because of the financial crisis. And by 2018, the data that we have shows that 11% of children were hungry or found to be hungry in the household survey data. But now we've reached the point where hunger levels are the highest that has ever been in the last 20 years.
Wow, and that can we put firmly at the door of COVID and what the lockdowns did to our economy?
Absolutely. That was the trigger. And we see too, the research that we've done, and I've done it with Sofas van den Berg and Grace Bridgman, and we've seen over time that the current levels of household hunger and child hunger is the same now, especially child hunger is what it was in the hard lockdown. So, you know, our situation hasn't improved. And of course, the phasing out, it was a staggered phasing out of the various relief of distress measures, the top-ups of the grants, the SRD, and then later, and the TERS, as well as declining food relief from not only government, but NGOs and the private sector, that all of that combined with below inflation increases of the grants earlier this year, and school closures had a huge impact on the levels of hunger that we see now.
Yes, of course, because that would be the school nutrition program. And we know that during the lockdowns, even while it was court-ordered, provision for school meals was patchy at best, wasn't it?
It was because of the rotational timetabling. And then a lot of children, are attending school from other areas, so they rely on scholar transport. And so it's difficult to reach them to come to school to collect the food parcels. The Department of Education, the school nutrition program, is working on that, and there's been a recent court ruling again. But there are logistical difficulties. We are trying through some of our own work in some of the urban areas is to work with community radio and encouraging, documenting where people can find food, and then to advocate for access to food and channeling them to the various agencies that provide support.
So this 350 a month is going to help. It's a number of measures, but it certainly has helped in the past, as we heard Lindiwe Zulu saying, and it will help get desperate families through this phase. Why March 2022? Is that because that's the date by which we hope most of the population that needs to be vaccinated will have been vaccinated and life can sort of get back to normal and we might not need it thereafter? Or are you of the view that this really is the precursor to a basic income grant that we've got to get going now?
Yeah. So I'm not sure why March 2021, But I think it's linked to the financial year, which ends in the end of April. So it's probably linked to that the government would allocate funding over the next 8 months. I think it's good also to say that it will be a temporary relief for 8 months because, you know, financial insecurity creates a lot of other social and emotional stresses in households. We've seen high rates of depression, and that's related to hunger and a sense of financial insecurity. So I think saying that stipulating a longer time frame is important. Is this the precursor to the basic income grant? Only time will tell, but I think that the government is also learning a lot about how the SRD works, you know, how it could be improved, what systems you need, and who knows, it could certainly evolve over time into the basic income grant. And that would be a targeted basic income grant for unemployed people and informal sector workers who are not currently covered by social protection.
A lot of people are saying, well, how on earth can we afford it? How could we afford it? We know that there was a greater collection of tax, which seems to be tiding us through this particular patch. But going forward, I think a lot of South Africans who are privileged enough to have work are saying there's no way we can carry on like this as a society being so incredibly unequal. Are we not inviting more instability, more looting for food? And we acknowledge that a fair amount of the looting was instigated, a fair amount of it was just purely criminal, but there was an element of people just wanting food. Are we not inviting more of that sort of instability if we don't get some sort of targeted basic income grant off the ground?
Well, I think that is important. I think government is sort of being a bit more cautious now given the financial constraints. The President did intimate that the funding would come from the revenue from the increased commodities prices. So government is feeling comfortable that it can fund this. Obviously, the economy needs to recover. More people need to get jobs back. And all of that combined with the grant system, as well as many other support services and systems, livelihood support programs, I think now's a chance to think creatively and innovatively about how the grants work together with a whole range of other interventions to support people in distress, but also in the long term to improve poverty and inequality outcomes. So it's more than just the grants, it's also having access to unemployment insurance and an employment that covers benefits, as well as access to social services. You know, a lot of it is also caused by service inequalities and access and poor quality service delivery. So all these things have to work together better if we are to make a dent and exiting people out of poverty in the longer term.
All right. Well, thank you so much for chatting to us this evening. Much appreciated. That is Professor Leila Patel, Director of the Centre for Social Development in Africa, and she's from the University of Johannesburg.